Hello, my name is Chris Grant. I'm a PGY2 at UC Irvine in the internal medicine residency. And I'd like to present my poster today, Thrombosis and Pro-Inflammatory Responses in COVID-19 with Cancer at a tertiary cancer center. And so just to begin, COVID is known to have many numerous coagulable factors that actually reach into that pro-inflammatory state in the Virchow's triad. Paired with that, cancer also has many of those properties as well. And so here at UC Irvine, we actually wanted to be able to correlate and see if there's a difference between cohorts who have cancer, cohorts who have COVID, and cohorts with both of them to see how their D-dimers were elevated and changed, and utilizing that as a universal inflammatory response marker. And so we actually took a look at some of the data of people who ended up developing venous thromboembolic events over the past 2 years. And what we found is when we placed them into 4 cohorts, COVID-19 with cancer and a clot, COVID-19 in cancer without a clot, and then COVID-19 without cancer with a clot, and COVID-19 positive without cancer without a clot, and subdivided them and compared and analyzed. We wanted to be able to determine if there was any changes in factors. And so we ended up having kind of a universal demographic who ended up having it with a variety of cancers, both solid as well as liquid, and then compared their mean D-dimers. And we were actually able to kind of analyze and determine between these subsets if there was any statistical significant difference. What we ended up finding was that there was not a statistical significant difference between the 4 cohorts. However, there's a lot more research that needs to be kind of determined to go through this. For example, many of the individuals only receive CTAs with a PE protocol due to kind of their high suspicion, and actually didn't get a D-dimer really throughout their hospitalization. And so further work and analysis to determine what those statistical significant effects are and some of those confounding variables is warranted.